Hey, Patrick. All right, man. I'm going to run through the knee training that we went over. This is basically going to be your daily work. So starting with the kneecap. Since we found that the lacking directions of movement were to the outside and down and to the outside and up, those are the directions that I want you to start with passive stretching. So you're going to get a firm grip on the kneecap, push it out and down. And you're just going to hang there for 2 minutes. Don't feel like, really with all these passive stretches, don't feel like as the stretch relaxes, you have to go deeper in the stretch to keep the tension the same. Actually, what you want is just find that current passive range, hang out there, and either, just wait for the 2 minutes to run out or wait for the stretching sensation to dissipate. With the kneecap, you're not really going to get a stretching sensation, but for the other ones, you will have that low-level stretching sensation that we want to feel dissipating over the 2 minutes. So outside and down, wait 2 minutes, push over and up in that upper corner, hang out there for 2 minutes. After that, you're going to go through 3 to 5 full kneecap cars in all those directions, which is basically like the circle. So, like pretty even pace all the way around, although you could bias a little slower pace towards those sides that we just passively stretched. So get that full circular direction 3 to 5 times, then reverse 3 to 5 times, then onto the tibial rotation. So for tibial rotation, the first thing you can do is just get a few warm-up reps where you're keeping your fingers over that little bump on the front of your shin bone and just to feel for rotation and get like 5 reps of rotation there. Once you get 5, then you're going to stay in external rotation. You're going to wrap your arm around the leg, grab the inside of the foot. The second hand is kind of optional, but I like the second hand because I feel like it just gives you a little bit more leverage and helps isolate the knee rotation versus ankle movement. So if you want, grab behind, almost like around the bumps on the bony protrusions on both sides of your ankle. Bumps is the technical term. And then rotate a little further than your active range. So if that's my active external rotation, all I'm going to do is apply a little bit more force to get it further out, with the goal of finding that kind of low-level stretch on that sort of diagonal on the medial side of the knee. I'm only looking for you to get like a 3 out of 10 there. So once you feel that 3 out of 10, wait for 2 minutes, and it's important that dissipates a little bit. Maybe it goes down to like a 2.5. It doesn't have to go away by any means. If you do find that it just completely goes away before the 2 minutes is up, you could cut that passive stretch short and then go into your PALS contractions. So PALS here, that's basically using your hands to try to externally rotate the knee more. So this hand is pulling out, this hand is kind of helping twist in that direction, and you're going to resist movement at the knee joint. So if I'm resisting, I'm basically contracting this stuff on the medial side that would pull my knee back into internal rotation. So when you do that, you should feel a little bit of a tension increase in that stuff where you felt the passive stretch. Again, since we're doing this for connective tissue focused work, it's low intensity, so your overall effort of trying to twist and resisting that, again, that's like a 3 or 4 out of 10. I want you to hold it for about 45 seconds. You can go a little bit longer there, but 45 seconds. So when you feel that load increase, hold there till 45 to 50 seconds goes by, slowly relax. That level of tension that you had should decrease when you stop the PALS contraction. That's always a good indication that you're doing it at a level that the tissue is going to tolerate. It didn't happen when we went over this stuff, but if you did get any lingering sensations there where there's tension that's just like you stopped the work and it still feels like it's there, just lower the intensity on the next one. And then you're going to repeat that 1 or 2 more times. So same thing, trying to twist out with the hands, resisting at the knee joint, creating that little bit of a stretch sensation here. 2 to 3 sets of PALS, then you're ready to do internal rotation. So again, you rotate in, you're going to reach across with the other hand, you're going to grab behind the ankle, and then you're going to twist in. And again, you're really focusing on making this whole structure twist in as opposed to just the foot, just because there is some independent ankle movement there. So I twist in, now with the goal of finding some stretching sensation right on the outside. Hang there for 2 minutes while it dissipates. If it dissipates completely in less than 2 minutes, go right into your PALS contractions. So PALS here is just the opposite of what you did. You're using the hands to try to twist in more. you're resisting rotation. So you're essentially contracting this stuff that would pull you back into external rotation. So we want to feel that tension increase right on that kind of diagonal on the outside of the knee. And you're going to do it at the same intensity, 3 or 4 out of 10, and you're going to hold that for 45 to 50 seconds, and you're going to do 2 to 3 sets of that. Again, just pay attention to that sensation there. Make sure it kind of dissipates between each one when you're fully relaxed, just so you know that you're doing it at a reasonable intensity. So once you've done that for both directions, we're not doing rails contractions yet. I'm just going to have you go through 10 slow repetitions of tibial rotation. So again, just like what you did to warm up, keep your fingers right on the tibia, rotate out, feeling that bone shift out. You can kind of squeeze into the end range and then slowly move back into internal rotation, feeling that bone shift in. You're just going to work into your end range, squeeze for a moment, go back, over and back counts as 1, do 10 slow reps there. Once you've done those 10 slow reps, then this is that lunge position that we talked about. I'm going to be just a talking body here, but basically what I had you do, whichever is comfortable as far as the foot position goes. This is a lot of big toe extension, but I had you kind of shift forward here. The goal isn't to get a huge stretch in the hip flexor. The goal is just to be in a little bit less than 90 degrees of knee flexion. So if you feel a huge stretch in the hip, you could bring it back a little bit, but try to keep it a little greater than 90. Like I said, over time, you're going to progress this to more and more knee flexion to where you're working somewhere back in here. But for now, we're just trying to stay greater than 90. And you're just going to do low intensity Pales contractions here, which is basically trying to straighten the knee out. So if I kind of get my glute squeeze and tailbone tuck, I start to push my foot down. We're getting that nice stretch through the quad. You're going to hold that for the same duration as the other Pales contractions. You're going to hold it for 45 to 50 seconds. Again, sticking at that low intensity, 3 to 4 out of 10. And then relax. I'd like you to do at least 2. You could do 3 if you want. One thing we didn't really talk about yesterday, but you could play with this just to see how it feels. I can go in, this is tibial internal rotation and tibial external rotation. So if I basically swing my heel in or out, you may find that one of those positions of rotation creates a little bit more acute tension in the knee. As long as it feels reasonable to load that, that's a good angle to work in. You might find that there's just more tension one way or the other. So play with that a little bit when you're doing these. If it feels the same all the way to both sides, then you can just kind of stay neutral. Once you go through those 2 to 3 Pales contractions there, then you're just going to go through about 60 seconds of full knee cars. So that's the one where you're basically getting the leg kind of into a chokehold. So my right arm's behind my right knee. I'm going to grab my bicep on the left. That way I have a free hand just to feel that tibial rotation. So my knee's in flexion. We rotate, external or internal, doesn't matter which direction you start. You're going to hold that while you extend the knee as far as your hamstring will allow. Then we externally rotate, and I'm feeling for movement here. You might find that if you're all the way as tight as your hamstring gets, that it's hard to rotate. So you can stop a little short, try to rotate, feel that tibial tuberosity move, come back down, go around, basically 2 in each direction, close the circle, come back, and then again, go back through. So go for about 60 seconds. With the knee cars, you can always go longer than that. You could go for 2 minutes if you want to take that extra time to do it. Since the cars are not max effort, you can't really do too many. That could be something else that you do throughout the day as well. You do a few extra knee cars. Even if you did like 3 sets of 2 knee cars in addition to this daily work, you're exponentially increasing the amount of end range stimulus on that stuff, and that's really, really good for your joints. So in the sense of low intensity cars, more is better. And that's pretty much it. We didn't really talk about the other knee, but all of these physical capacities are fleeting. So getting a little bit of stimulus on that knee could be good. And that could be just as simple as like, after you get this stuff done, just run through like 1 or 2 Pales contractions for rotation on that side, do some knee cars. At least that way, that other knee's getting some stimulus too, just to make sure it's not lagging behind. And that's it. And I'd love to see how this feels in a week. And of course, even further down the road, because connective tissue is slow to change. But if you have any questions on that stuff, please let me know. Or if I can clarify anything, troubleshoot, whatever it is, just keep me posted, man. It's great working with you. Looking forward to the next one. See you soon. Thanks.